Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. And today's guest is Barry Clark. He's the president and founder of WestFax. Welcome, Barry.
Hi John, it's great to be here.
Yeah, so we're here at the ViVE 2022 conference, but what's a fax company doing at ViVE?
You know, it's been a great day for us. We introduced the new WestFax Comprehend product today, which we're very excited about. It enables fax, and we use what's good about fax, 100% interoperability, universal acceptance, ironclad security, and we add an automated workflow to that to save time and money for improving patient care.
Yeah, it seems like that's one of the biggest topics here at ViVE and actually in healthcare IT in general. How do I automate everything? So, are you able to automate the data? Tell us a little bit more about the product.
Sure, we developed a proprietary patent-pending AI engine that enables us to grab the fax, which is basically a stone tablet from a picture,
yeah,
something
an image, right?
Yeah, and a human in most enterprise situations has to look at that fax to determine what it is. So we've trained our AI engine to look at millions of different medical document types to determine what does an ROI look like, what does a prescription refill look like. So WestFax Comprehend enables you to categorize those inbound faxes to determine what type of document it is, and then it gives you that structured data at the end in a fire-ready data set that can be imported directly into an EHR.
Yeah, now that's powerful. I love making the fax more useful, taking the people from having to do monotonous jobs. That's a powerful idea.
That's right.
But I think what's interesting in our conversations, I've been fascinated when you look at the fax infrastructure. And we're here at ViVE with a lot of CIOs from the Chime organization here visiting. But why should they care about their fax infrastructure?
It's a great question. There's a lot happening in the world of telecom right now, and at its essence, a fax is basically a phone call. So when you look at T38 and SIP and all the different ways to send a fax, the tried and true method is still traditional dial mode, which is the primary mode that we use in transmitting fax. So we're able to achieve 33.6 baud rates, which to CIOs means less chance of error and less cost, because if you're sending a 10-page fax, fails after 3 pages, second attempt fails after 7, and finally goes through on the third attempt as a 10-page fax, you're actually paying for 17 pages of fax. So having a solid TDM backbone is why CIOs should consider using WestFax.
Well, I think what's interesting about that, right? I mean, you just said it's just a phone call, and I think in most CIO mind, most tech people's mind, they're like, well, the phone always works, right? And so they're like, how does that really impact me? It sounds like one area is that there's an increased cost. Are there situations where the fax doesn't go through and maybe patients are impacted?
Oh, absolutely. If you can't get a lab result and a doctor is looking for a lab result to make a diagnosis, or if there's a manual data entry element that has to happen, or someone has to look at that document, process what it is, and then add it to that workflow, it could certainly impact patient care, and it does every day in America. That's why I'm so proud of this new product.
So it makes sense. Reliability matters. The cost matters. The cost explodes when you don't have a reliable fax infrastructure. But I think this new product actually is kind of the next generation of technology where people might say, oh, it's not just a fax. It's much more. Is that what you see as kind of that next generation of fax technology that people should be embracing?
I do, and the beauty of it is that it presents 100% interoperability right now, today. So we don't have to worry about Epic talking to Cerner or all these disparate battles for turf in the EHR world. Fax works with all of them. It's inexpensive. It's interesting, you and I had a discussion a couple weeks ago about health equity and how fax has an impact on that. We have rural health clinics in areas where they're paying a very small monthly fee to send and receive fax documents, and they're not connected to an EHR. This new WestFax Comprehend product would enable them to use any Windows folder to manage all of their patients without an EHR. They could take that inbound fax, run it through the Comprehend workflow, and have structured data on the other end in a file. So it can go all the way to a fire-ready data set that can be imported into an EHR, but it's modularized and can also be set to go into just a file on a Windows PC somewhere.
Yeah.
So that's the beauty of it.
Yeah, I mean, I think of all the behavioral health providers, the long-term post-acute care, skilled nursing facilities. They didn't get the stimulus to adopt an EHR.
That's right.
That they still need to communicate with the health system, and the health system wants to communicate. And unfortunately, or where we're at, right, fax is the reality for many. Is that, you know, the experience you're seeing?
Oh, absolutely. And it's great to be able to provide that service to people where that critical care is needed, where we can provide an affordable solution and really promote health equity.
Well, and I love you've done the granular data elements as well. I think that changes the experience of a fax, because then it solves that workflow problem for the organization that's receiving the fax. So that's great. So where can people go to learn more about WestFax?
To schedule a demo of our new Comprehend product, you can go to westfax.com to schedule a demo.
Awesome. Thanks so much, Barry, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com.